Part 1 demonstrated the initial actions to be taken in a first aid incident. It demonstrated the first aid that all seafarers need to understand, how to manage a situation, and the actions to take to potentially save a life. In Part 2, we look at a variety of major and minor injuries and illnesses that seafarers also need to know about. Some first aid situations will need immediate actions. Officers or those on board ship who have completed additional first aid and medical training will carry out continuing first aid. The first aider then becomes an assistant in the situation and follows instructions. In some instances, action may not be taken until radio medical advice has been sought. In all the examples, the first aider will always carry out DRABC: danger, response, airway, breathing, and circulation CPR. They will also assess the scene to establish what has happened and ensure it is safe. Assess the casualty, then treat and monitor them, remembering to treat for any shock. In all situations, the airway always takes priority. For additional information, use the accompanying workbook. The musculoskeletal system comprises bones, tendons, ligaments, and muscles. The skeleton provides the framework for the body and gives some protection to internal organs. Muscles move the skeleton. They are attached to each other or to the bones by tendons. Ligaments bind bone ends together in joints and support internal organs. A broken bone is known as a fracture or a break. Although the outside of a bone is hard, it may crack or break if struck, twisted, or overstressed. Fractures can be caused by indirect trauma such as falling on an outstretched arm, muscle action, a twisting or wrenching movement, disease that causes the bones to be more fragile, or by direct impact, for example, an object hitting someone's leg. There are 3 types of fracture. In a closed fracture, the skin surface around the damaged bone is not broken. In an open fracture, the broken bone has penetrated the surrounding skin. This type is more serious because of the additional problems of bleeding and exposed bone with high risk of infection. A complicated fracture is where there is an associated injury, such as damage to an internal organ or an important blood vessel. Any of these types of fracture may be stable, with bone ends not moving, or unstable, where the ends of the broken bone may move. There are a number of features that will help in diagnosing a fracture. There may be pain at the site of injury as well as tenderness, bruising, redness, or even visible bone. There may be a lump or other deformity, which could include shortening of a limb. There may be loss of movement or power. Fracture management includes immobilization. This reduces the pain, prevents further injury from bone movement, and makes moving the casualty easier. In an open fracture, control of bleeding and wound management will also be necessary. The injury should be monitored, including blood circulation distant from the injury. If the bone is protruding, the management of bleeding is the same as for a wound with a penetrating object. To stop bleeding, put pressure on the wound at the base of the protruding bone. Never put any pressure on the bone itself or attempt to push it back into place. Dressing should be built up around the bone and secured. A sterile, non-fluffy dressing should be placed lightly over the bone, but it should be labelled to make it clear that it covers exposed bone. This reduces the chance of pressure being placed on it by mistake. The injured limb needs to be monitored by checking the circulation below the level of the fracture. Is the limb warm and a good colour? Is a good pulse present? Is there any nerve damage? Is the casualty complaining of loss of sensation, numbness or tingling? After the wound has been dressed, the next stage is to immobilize that part of the body which has been affected. There are a number of immobilization methods available: supporting with a pillow, using slings and bandages, or using a splint, as in this case. The person in charge will decide the best form of immobilization to be used according to the injury, whether evacuation is imminent, or how the casualty is to be moved. Splints should only be used by someone who has been trained in their use, as harm may be done if they're not used properly. There is time when managing a fracture to consider the options available and whether the casualty needs pain relief before immobilization and moving. A fractured leg may be secured to the non-injured limb using triangular bandages, as in this case. To do this, place padding between ankles and knees, as well as in the gaps between the legs. Line up in position the triangular bandages before applying and securing. The foot should be tied first using a figure-of-8 method. All knots should be placed on the side opposite the injury and loose ends secured in place. The sequence of ties is joint below and joint above, then immediately above and below the fracture site. The natural hollows at ankle and knee should be used to place bandages, which are then slid up or down into position on the leg. The injured leg is never raised, as it is not supported under the fracture. Further information can be found in the accompanying workbook. A high or elevation sling is used for injury to the collarbone or ribs. It is also used when elevation of the hand is required to reduce swelling, as in burns to the hand, or to prevent movement as part of bleeding control. Tie a knot at the elbow point. Then place the triangular bandage over the front of the elevated arm, with the long edge down the body and the point of the triangle to the elbow. Place the sling over the arm and tuck fabric under the fingers and arm while holding the elbow knot in place. The elbow is automatically supported as the sling is tightened. The fabric is taken around the back of the casualty and the end points tied together. The finished sling should support the elbow, prevent the arm from slipping out under the sling, and allow access to the fingers to check circulation. Further information can be found in the accompanying workbook. A low or broad sling may be used for an injury to the lower arm, upper arm, ribs, elbow or shoulder. Place the triangular bandage under the arm with the elbow at 90 degrees, the long edge down the body and the point of the triangle to the elbow. Lift up the lower point and take up around the neck to tie with the upper point at the neck. The arm should be fully supported from elbow to fingertips and not droop. The finger should be accessible to check circulation. Further information can be found in the accompanying workbook. A dislocation is a joint injury in which the bones are partially or completely pulled out of position. It can be caused by direct impact or muscle contraction. The signs and symptoms are similar to a fracture. There may be pain, swelling, bruising, or deformity. There will be loss of movement and loss of power of the affected limb. As with fractures, the immediate aim should be to immobilize the limb. Broad fold bandages are used for this type of injury, as well as elbow injuries. The idea is to splint the arm to the body when injury prevents the use of a low sling. Take care of any associated wound, monitor the circulation, and treat the casualty for shock. Torn ligaments may be associated with a dislocation. The consequences of a dislocation can be severe, even resulting in paralysis if major nerves are involved. No attempt should be made to relocate the dislocation. Further information can be found in the accompanying workbook. In this section, we have shown general first aid for fractures and other injuries relating to limbs. Full first aid details of these and other types of fracture can be found in the accompanying workbook. If there is any part of this section you do not understand, please revisit the relevant information, and when you are confident you understand, move to the next section.